There's many changes that can actually happen, and these are physiological changes. For example, the output from the heart decreases as one ages. The muscle of the heart also becomes much stiffer with less relaxation as the heart ages, and then one can become hypertensive just due to the fact that you're aging. So I think that the surveillance of these issues needs to be highlighted much earlier so that treatment can actually be initiated to prevent the long-term sequelae from these chronic conditions.
So, looking at your career, you've worked in numerous hospitals, public and private sector. Specific reason why you're attracted to taking care of the elderly?
I think it's quite a rewarding job. I think that these patients are quite grateful. They're also quite aware of the fact that there are complications in their lives. And I think the interest was actually peaked when I started doing a bit of home care during my university days in the UK. And I think that there's a huge deficit with regards to care, specifically South Africa, where there are very few qualified geriatricians for many reasons. And I think that the way these patients are managed, one needs to actually educate ourselves in a much better way so that we're able to give them the best possible care.
Well, I agree with you. I think our senior citizens are the treasures of our society, right? They've paid their dues and have helped our country, our communities, their families and loved ones in so many ways. So you need to be commended, you and your colleagues who are specializing in this area of medicine. Over the weekend, Dr. Kalideen, I did try and find out how many geriatricians there are in the country, and I was shocked. I could count them on both of my hands.
Yeah, I think I am a part of the South African Geriatric Society, and if I look at the email list, there's probably about 20 people that get
Right.
emailed on a regular basis. And I think that there's also a lack of training in the public sector. I think that geriatrics is probably considered to be one of the stepchildren of medicine, where there is a focus on training additional specialities, and geriatrics is not necessarily one of them, unfortunately.
Considering whilst we're a young population, we will be aging. You're looking at the way the planet's going. I did say, and I quoted the Pew Research Center, United Nations, at the start of the show. We will have at least 1.5 billion, geriatrics amongst us by mid-century. Babies who are born in 2012 are going to be living, until 100 and then some. So there needs to be more specialists in your field, don't you think?
Absolutely. I think that if we compare ourselves to other countries like the UK, the US, and other first world countries, we're definitely lacking in terms of how we're managing our elderly patients. I think that, I've done some work in the NHS in the UK, and these patients are actually aging to perhaps 90, where they're fully functional. And by fully functional, I mean they are completely independent, driving, able to do everything for themselves. And I think that these patients require additional support, especially to find out whether there are any areas where they can actually be assisted. And by that I mean from a social point of view, financial point of view, etc. And I think that's something that's quite important with regards to care in the home environment.
It's 20 minutes after 7 o'clock. It's Monday night. You're on Lotus FM. My name is Alan Khan. My studio guest tonight is specialist physician Dr. Letasha Kalideen, and we're talking about geriatric medicine. I'll talk to Dr. Kalideen about some interesting areas around this, including memory loss, dementia, Alzheimer's, mental health, and I'm also intrigued to find out about cannabis use and what Dr. Kalideen seems to think about that within her field of scope. We'll open up the lines tonight if you want to call in and speak to our specialist physician. You needn't be 65 plus, right? Any medical issue will help you, although we're talking about geriatric medicine. But pick up the phone, give Michael Bachchan a call. He's our engineer tonight on 089 310 8789. Umesh is not in this evening, but Michael is here, so give him a call on 089 310 8789. Or you can WhatsApp